After knowing what is chikungunya, what are its symptoms and how do we diagnose it, it is extremely important to understand how should we treat or manage this very debilitating infection, which at times can cause very frustrating multiple joint pains in our body. So hello friends, I am Dr. Piyush Chaudhari, bringing to you the next video on the YouTube channel of Fever Care Center for Infectious Diseases, in which we are going to discuss about treatment of chikungunya. Most importantly, please do watch the video till the end, because in the later part of the video we are also going to cover what management should be done in people who have chronic recurrent joint pains after having gotten chikungunya few months back, and which is a more debilitating and frustrating symptom in the long run. So like we saw in the signs symptoms video, chikungunya can be divided in acute, subacute and chronic phases. So similarly, treatment of chikungunya can also be divided in acute, subacute and chronic phases. So in the acute phase, that is the very beginning of the illness, when fever, rash and joint pain predominate the picture, most important things to understand are that there are no particular antivirals or antibiotics which are required in chikungunya because it is a self-limiting illness, and no antibiotics are going to help in this phase. Secondly, antipyretics, so paracetamol like medicines for fever and mild pain, or analgesics. So going stepwise from paracetamol to paracetamol plus tramadol combination, and if still joint pains are more, then going to NSAID group of drugs like aceclofenac, diclofenac, naproxen, piroxicam, etc. is the stepwise approach in managing the pain related to chikungunya in the acute phase. Most important point here is taking adequate rest, maintaining adequate hydration, and for those people who have significant joint pains, they can use ice fomentation or cold compresses over the joints where they have joint pains. In this phase, there is absolutely no role of using any form of corticosteroids in treating these patients, because in the initial 7 to 10 days, like we saw in our previous videos, this virus is very much there in the blood. So we are in a viremic phase. So by using steroids very early, we can in fact weaken our immunity from fighting with this virus and prolong the periods of viremia, leading to persistence of virus for longer period in our blood, leading to more long-term impacts and complications. So in wanting to prevent joint pains or prevent chronicity, we should not be fooled into using steroids in the initial 2 or 3 weeks of, that is, acute phase of chikungunya. Now coming to subacute and chronic phase, it is important to assess what is the severity of pain and what is the extent of joint pain that the particular patient is having. So this can be done by several parameters, like how many joints are involved where the person is having pain, whether there is only joint pain or there is significant joint swelling, also how often the patient's sleep is disturbed because of these joint pains, and more objectively we can ask the patient to rate his or her intensity of pain on a visual analog scale, wherein 0 means absolutely no pain and 10 means excruciatingly severe joint pain. So herein we have to use stepwise approach to using the pain relief medications. So if someone has 1 to 3 intensity of pain on VAS, that is mild pain, in these patients, paracetamol with or without opiates like tramadol can be used with proper medical advice. Someone who has moderate pain or someone whose pain persists beyond a week in spite of using paracetamol and tramadol, in this group of patient, NSAID group of painkillers, that is your aceclofenac, diclofenac, naproxen, piroxicam or similar agents from different NSAID groups have to be used. If the person doesn't respond to one group in a week's time, then group can be changed, and only after a patient remains unresponsive after 2 weeks of treatment with these agents, or if the intensity of pain is severe, that is between 7 to 10 and multiple joints being involved, or the patient requires support from even basic daily activities, only then steroids should be considered in this phase of treatment. And here again, steroids have to be used in much lower doses and for much shorter periods. So as soon as the improvement starts, the steroid dose has to be gradually tapered, and typically after the pain completely subsides, the steroid should be stopped within 3 to 5 days from that day. And overall, Steroid should not be used beyond 1 month in any of these subacute or chronic phase patients post chikungunya having various forms of arthritis. Because if steroids are used too long, beyond a month, then relatively it has been observed that the benefits are not much, but there can be several harms in terms of increase in gastritis, increase in incidence of peptic ulcers, increase in blood sugar levels, especially in patients who have diabetes or pre-diabetes and requiring higher diabetic medications as a result, effect on the osteoporosis of the bones, and also impact on the immunity, which gets lowered because of steroids, and the patient may be predisposed to various other infections. So what after steroids? So mainly in patients who are in chronic phase, where we have three possibilities. One, post chikungunya chronic inflammatory rheumatism. So rheumatoid arthritis like pain which occurs several weeks or months after chikungunya, or worsening of underlying rheumatoid arthritis or other similar arthritis related chronic diseases after having recovered from chikungunya, or third, polyarthralgia with involvement of tendons, synovium and muscles leading to various chronic musculoskeletal inflammatory disorders. So in these three groups, after using the NSAIDs and corticosteroids in a sequence, if there is no adequate response in the symptoms up to several weeks after using these agents, then specific type of drugs or group of drugs called DMARDs or DMARDs, which are the drugs which are used in treatment of rheumatoid arthritis, they can be used. Now among these drugs, most importantly, hydroxychloroquine should always be the first medication to be initiated, and its dose should be optimized within first 1 or 2 weeks of initiating the treatment with proper medical advice. And after optimum dose, if there is no adequate response in the symptoms, even after 8 to 12 weeks, only then other types of DMARDs should be considered. So like methotrexate, leflunomide or others, because all these agents in the long run can have several other side effects which are absolutely undesirable, like impact on immunity, impact on blood counts, impact on liver or kidney functions, which makes use of these agents absolutely restrictive only for patients who do not respond after adequate doses and course of steroids followed by 8 to 10 weeks of hydroxychloroquine. These agents should not be used hurriedly too early in the course when they may not be needed and when their risk can definitely outweigh the benefits. Now, if we see friends, most of these treatment modalities involve drugs like painkillers, steroids or DMARDs, which have their own issues in terms of side effects. So it is very important to know what are different non-pharmacological methods which can help us in managing these patients. So as I told, in the acute phases, ice fomentation or cold compresses can be extremely useful. As the patient goes from first week to second week, where the fever has usually subsided and the fatigue related to viral infection has already subsided, the patient should definitely be encouraged to start light physical activity. In the subacute to chronic phase, various physiotherapy exercises which involve stretching of various muscle groups and joints, complete range movements of various joints, which in fact is known to improve the pain related to post chikungunya rheumatism, should always be encouraged. Plus, there are certain physiotherapy modalities which can help in alleviating pain in this group of patients, and they should always be encouraged to keep mobile and keep active as much as possible to prevent long-term contractures or reduction in range of movements of their joints and loss in strength of their muscles. So with this friends, we end this video on treatment for chikungunya. If you have liked this video, please share and do subscribe to the YouTube channel of Fever Care Center for Infectious Diseases. Remember, stay informed, stay healthy.